So, what is an underbite? Now, an underbite is a situation where the top and bottom jaws are just not matched properly. So what we find in patients with this problem is the fact that the lower jaw is either a lot bigger than the top jaw, or similarly, the top jaw is actually a lot smaller than the bottom jaw. This can cause a number of problems. One of the main issues is the aesthetics of how everything looks. Another issue is it can also cause bite problems as well as tooth wear. The other issue is if the jaws are really mismatched in terms of their size, it can actually even cause severe crowding of the teeth, which can make things very difficult to keep clean. How do we fix an underbite? Now, underbites can be fixed in a variety of ways, and it just depends on how severe the underbite is. For example, if you've got a big discrepancy between the top and bottom jaws, then surgery may be the best option for you. However, there is some good news for those with sort of a less severe situation. In that case, we can basically move the top teeth forwards and the bottom teeth backwards so that the bite gets completely reversed into a more comfortable and more aesthetic position. And if you are thinking about something like composite bonding, there are ways we can move the teeth to help facilitate the best outcome for that. Can my underbite be fixed with Invisalign? The short answer is yes, it can be. However, in some cases, we would advise surgery in order to reposition the jaws so that the top and bottom teeth just meet a bit better. In a situation where we need to bring the bottom teeth backwards and the top teeth forwards, we have to find space. Now, one of the ways we create space is by maybe taking one or two of the lower teeth out. What this will do will position the top and bottom teeth as such so that once the teeth are removed, we then push them backwards and then they'll fall into line behind the top teeth. This enables us to then function normally and bite much more comfortably. So what causes an underbite? Now, usually most of the time is because of the actual size of the jaws, where the bottom jaw may be just slightly larger than the top jaw, and this can cause the bottom teeth to then be set forwards in front of the top teeth. One of the other main reasons why you could have an underbite is because you could have had some teeth on your top arch or the top teeth, one or two of them removed. They may not even have erupted, and in those cases what happens is that the space in the arch is constricted, and what this can cause is the top teeth to then sit behind the bottom teeth, which then causes a situation where the bottom teeth are in front of the top teeth and leaving you with an underbite.